I'd like to welcome everybody to our presentation, What Every Church Needs to Know About the Affordable Care Act. And we'll get started here right away talking about this very important subject. I know your time is valuable and we have a lot to cover, so let's get going. So probably the first question that you have is, who is this guy making the presentation? Well, my name is Marty Hartman and I'm from Greenville, South Carolina. I'm a family guy, like many of you are. You can see that picture of my wife and my daughter at her graduation. Just in case you're wondering, I am the one on the right. And also wanted to show we also have another member of our family. This is Sophie, currently my wife's favorite child. But Sophie, the reason I mention her is I'm recording this from my home office. And even though Sophie's behaving most of the time, she may have a comment about the Affordable Care Act. So if you hear Sophie in the background, that's what's going on there. But I've spent over 20 years in insurance companies. I am a licensed agent, appointed and federally certified. And all of that information may not mean much to you. Sure, this guy knows a little bit about insurance. What does he know about churches and what's going on with churches? Well, I have been spending the last couple of years helping my good friend Marshall Shannon, and there he is right there. And Marshall is the brain trust for ministry design training. Now, many of you are familiar with ministry design training and what a valuable resource it is for the folks in ministry. But when I was helping Marshall put ministry design training together, getting the website going and offering whatever help I could, his passion and concern for the local church was very evident. And from the things I learned from him, it became evident to me that the local church in the United States needs whatever help that they can get. And I'm sure that a lot of you pastors and church workers that are listening to this would agree that the church is under assault and that the people that work in the church need all the help they can get. So when I found out about the Affordable Care Act, some of the things that I found out, I immediately thought, the people that need to hear this are the people in the church. And that's why I put this presentation together. So another reason that I wanted to do this presentation and why I feel I'm qualified is I know firsthand the importance of health care. I have, in the last few years, had 4 eye surgeries, multiple trips to the emergency room. So any of you, if you've had health issues, you understand how devastating that can be. I've even had an ambulance ride, which is one of those things I've always wondered about. What's it like to ride in the back of an ambulance? Unfortunately, when I had my ride, I wasn't feeling well enough to really enjoy it, but that goes with the territory. So I know a little bit about the importance of health insurance, and you do too. And why do I say that? Well, when we are talking about the importance of health insurance, I just asked this question. In your church, when people are sending prayer requests or publishing prayer requests or asking for prayer requests, what are the subjects that they are usually requesting prayer about? Now, they can be all different types of subjects, but I know that in my church, they fall into a certain range. And I have asked a lot of other folks who are in ministry who verify this. And let's see if that resonates with you also. But most prayer requests seem to be either health related, somebody has an issue with their health or the health of a loved one, or they're financial related. They're going through financial difficulties and need some help, or both. There's a health issue that is expensive and they don't have the means to pay for it. That's an important consideration. And I'm sure that resonates with most of you who are pastors or church workers, or even if you're just a member of a church and active in a church, I'm sure that resonates with you. And that's why this topic is so important. So let's get on with how this can be helpful for the people that are in your church. This chart from the Kaiser Family Research Foundation is very interesting to me because it shows what the uninsured know. And this is an interesting chart because the uninsured, you can see by that top bar, 89% of them do not know the open enrollment begins in November. Now this survey was taken in October, so the enrollment period had not started yet. Now we are well into the enrollment period. So if they do not know about the enrollment period at this point, they really need to know about that. Almost 90% or 9 out of 10 uninsured do not know about this. I have seen some surveys that mention other aspects about the Affordable Care Act that have that same high number. And the next bar, 66% know only a little or nothing at all about health insurance marketplace. That's well over half. And let's look at that bottom bar, 53%, still over half of the people who are uninsured do not know that the health reform law provides financial help to low and moderate income Americans. That to me is just really astounding, having been working in the health insurance field for a little bit of time and knowing what I know about the Affordable Care Act. It is astounding to me that many people are not aware of the help that's available. Hopefully, this presentation will be a way to get that information out to the people that need it. And so let's go on to the next step. It's not too surprising that people don't understand everything about the Affordable Care Act because it's overwhelming. The original law was over 2,000 pages. Now, a really thick metropolitan phone book is going to be about 1,000 pages. So imagine two of those stacked on top of each other. That's the original law. There are over 20,000 pages of regulations that have come out from those first 2,000 pages. So this is an astounding amount of material. So it's not impossible to comprehend how people just don't know what's out there. But you only need to know a few things about the Affordable Care Act. And here it is. All you need to know is you need to buy a plan with minimal essential coverage, or you need to get an exemption, or you need to pay a fine. And that's really what it boils down to the people who don't know a lot about insurance. If you, after viewing this video, meet up or know somebody, or you have a family member or somebody in your church that's in this situation, you can tell them, here's one of the things that you need to do. Buy a plan, get an exemption, or pay the fine. That's what you need to know. Now, obviously, there's more that we need to cover, and we will cover some of those things. So let's get on with some things that cause confusion. And these are the things that I've run into time and again. People don't understand what's the marketplace and what are exchanges and what does that all mean. Well, basically, the Affordable Care Act sets up a place where people, either through the marketplace or the exchange, those are two names that mean the same thing, either through a state or a federal exchange, they are able to look at all of the major medical plans that are available to them so that they can make a decision. So that's basically what marketplace or exchange mean. Now, another thing that's confusing, there are no government health plans on the exchanges. There are government regulated plans. Now, I have talked to a lot of people that are very smart people with college degrees and a whole lot of learning going on there, but they don't understand that they think that Obamacare or the Affordable Care Act is some type of a government insurance scheme. And I've had people that I know that they are in need, and I bring up the subject, well, have you thought about can we talk about the Affordable Care Act, or exchanges or Obamacare, or if you bring that up, they just adamantly refuse. I don't want anything to do with government insurance. But the plans that are on the exchanges are government regulated plans. These are are plans from companies that you have heard of, like Humana or Blue Cross or Blue Shield, countless other insurance companies that have been around providing health insurance for years and years. These are the companies that are represented on the exchanges. Now, a lot of people are not aware of that. That's confusing. So another thing that's confusing, and when we talk about people that are adamant about not wanting to have anything to do with the Affordable Care Act because they've heard a lot of bad things, healthcare is a government road. And what do I mean by that? Well, let's just use this example. Uh, every one of you, when you go from your work to your destination, such as your church, so if you're a pastor and you're going from home to church, unless you live right next door to the church, you're going to probably be driving on some roads. Everybody's got the concept of roads down. We know how they work and what they do. But roads are designed, funded by government entities, whether local, state, or federal. To ride on a road, you are riding on a government system, basically. Now, these roads, even though they come about through taxpayer dollars, they are built by private contractors. But if you have a car and you don't want to drive on a government road, you're going to have a long driveway, or maybe you own your own personal speedway, then you can drive around in circles. But if you want to get from one point to another in this country, you're going to have to drive on a government road. And I mention that because the Affordable Care Act is a government road. In other words, if you want to purchase a major medical insurance policy in this country, you're going to have to purchase one that has met all the requirements of the Affordable Care Act. So in that respect, even though you're dealing with a private company, it is something that you have to deal with. The Affordable Care Act has a part to play in it. If you want health insurance, you have to travel down that road. Hopefully that makes sense now. Now, there's a lot of good things that are coming about from the Affordable Care Act. One of them is that there's no exclusions for pre-existing conditions. Now, that's a really great thing if you have something like asthma or diabetes or some other condition that may have kept you from getting health insurance previously. So that's a good thing for a lot of people. There are no spending caps on your insurance. Now, what that means is that all of these plans that are offered have a cap on what you will be what you will spend, or what are out-of-pocket expenses, and what the insurance company will spend. In the past, insurance companies may have, depending on the policy, it's likely that they would have put a cap on the maximum amount that they would have paid out, and that has been taken away. And I mentioned a little bit about maximum out-of-pocket limits. These plans have a limit to what you are going to be paying out of pocket, and then the insurance will take over from there. That's a good thing also. There's also coverage for children up to age 26, even if married and not living with parents. That's a good thing. If you happen to be 24, 25, 26, and you don't have any coverage, you can get on your parents' plan. So that's also a good thing for many people. And there are also some other good things, like this list. This is the mandatory coverage of essential health benefits. Now, this is a lot of information, and I'm not expecting you to know all of this, but just glancing through this list, you can see that there's a lot of things on this list. Now, these are mandatory coverages, meaning all of the plans that are offered through the exchanges are going to have these mandatory coverages. So that's also a good thing. So what's the catch? All of this good stuff, what's the problem with the Affordable Care Act? Well, all of these additions makes insurance more expensive than ever. And you no doubt have heard people talking about how their policy has changed. What they had before is now more expensive. And that's very likely true for many Americans, that what they are paying is currently very expensive. So if there are no pre-existing conditions, penalties, why not buy coverage when I need it? That's a great question. If you aren't penalized for pre-existing conditions, who would buy insurance unless you got sick? That's an excellent question, and the reason is adverse selection. Now, adverse selection is just that's an insurance term, meaning if insurance is so expensive that only sick people would buy it, then only sick people will have insurance. And if that's the case, then it's an impossible scenario. If only sick people buy insurance, then the whole system collapses. So what the system needs is to have people that aren't sick get into the system. Now there's two ways that they do this in the Affordable Care Act. The first way is through limited enrollment periods, and that simply means the only time that you are going to be able to purchase this insurance for 2015 is going to be through the enrollment period, which is going on right now. So the enrollment period through 2015 is November 15th, 2014 through February 15th, 2015. So we still have some time, but the clock is ticking. In order to get coverage as of January 1st, 2015, you would have had to purchase your insurance by December 15th. That date has come and gone. We are quickly going to be into January, so you're not going to be able to get your insurance by January 1. You will be able to get it depending on when you buy it. So, for example, right now it's late December. It's after the 15th. If you were to purchase your insurance before the end of the year, you would be covered for February if you purchased your insurance before the end of December. Now, as we mentioned, the enrollment period goes to February 15th. If you purchased your insurance in February, you'd be covered starting March 1st. Hopefully that makes sense. If you don't enroll by February 15th, you can only get health coverage for 2015 by qualifying for a special enrollment period. Now, what does that mean? Well, we have the open enrollment period now, but a special enrollment period would be a significant life event. For example, a marriage, divorce, a new baby, an adoption, or moving out of your current state to another state. Then you would be eligible to purchase insurance in that new state. So not everybody's going to have a special enrollment period, and this whole thing keeps people from just putting off insurance and saying, I'll buy it when I need it. You have to buy it at specific periods. Now, the second part about avoiding adverse selection is that you'll have to pay a fine, or what the Affordable Care Act calls the individual responsibility payment. You will have to pay that if you don't buy the insurance. And many of you have heard about the fines already. So let's take a look. What are the fines? You will pay the greater of 2% of your yearly household income, or $325 per person for the year. That's for adults, or $162.50 per child under 18. And the maximum penalty per family using that method is $975. So depending on which formula you use, you can do a calculation. You would be paying a fine which would be the greater of those two. And in case you were thinking, well, I'm sure nobody will notice if I don't pay the fine. There's millions of people that are going through the system. They'll never know that I didn't pay. Well, the IRS will be collecting the fines. So if you're filing taxes, it's going to come up. So don't think that you can get around it. Now for some good news. After talking about fines, I'm sure everybody's up for some good news. So here it is. We have a chart. Now this chart shows the federal policy levels. Now these levels are used to determine subsidies that you may be eligible for with the Affordable Care Act and those policies that you purchased in the marketplace. So if you look at that column on the left, 100%, that is the federal policy level. And you can see if you have a household size of 1, if you make $11,670 or more, then you are eligible for a subsidy. Now, the subsidies go up to 400% of the poverty line, or that 11,670, all the way over to 46,680. That's that column on the right for a single person. If you fall somewhere in that category with a household size of 1, you would be eligible for a subsidy. Now you can calculate your own subsidy by just taking a look here, a look at the household size on the left, and then you can calculate where you fall in this chart to determine, do I get a subsidy or not? So you can see that, let's say you have a mom and dad and 6 kids. That's going to be a household size of 8, the bottom row. And you can see that in that case, you could make $160,000 per household and still be eligible for a subsidy. So for some people, this chart is some very good news. Now this chart is only for the main 48 states. Alaska and Hawaii have another chart, but it does give you the idea. So let's talk a little bit about the subsidies. Over 60% of people that live in the United States are eligible for some type of a credit or reduction in rates. And as we talked about in that first chart that we showed, over half of Americans are not aware of this. That tells you that in a typical congregation, half of the people in your church may be eligible for a subsidy. Now, going back to those prayer requests that we talked about, you probably can think about some people that may need to know about this, because as we showed from that chart previously, half of the people in this country don't even know that they can get subsidies. That likely pertains to people that you know and care about. So let's give you an example about the subsidies. Let's take a 35-year-old who makes $20,000 in income. You may know somebody like this. You may be this person. I don't know, but let's just take them for an example. There are plans available with the subsidy. The premiums would be $18 per month, or $216 per year. That really is something that would be affordable for somebody making $20,000 in income. Now, that person also has the option, if they choose, to get no insurance and pay a $325 fine. So you can see that in a case where somebody has decided they don't want to play ball, they're going to pay the fine, they're just not going to bother with getting health insurance, they're going to remain uncovered, they would actually pay less by buying a policy in the marketplace. This is something that you need to be aware of. So let's talk about that. Let's say somebody does buy one of those policies on the marketplace. What do they pay? What does the insurance company pay when it comes to actually having to pay, aside from the premium? Let's say something does happen, they need some medical care. Well, the first part of what is paid is called the deductible. And a lot of the plans that are on the marketplace, on the exchanges, have very high deductibles, which keeps the cost of the insurance down. Now, many people are going to be choosing those policies because they're going to be less per month in premium, because they know that they'll have to pay the premium. Hopefully, they won't have to pay anything else out of pocket. They're going to be well and healthy for the coming year. But if they do have something that happens to them, they need some medical care, the first part is going to be under the deductible, meaning they will pay out of pocket until that deductible is met according to each individual plan. Now, once the deductible is met, then the coinsurance will take place. Now, depending on the plan, there is going to be different amounts of coinsurance. There could be a 30% the policyholder pays, 70% the insurance company pays. It's going to be all different types of percentages there, but this gives you an idea. Once the coinsurance Once you start paying the coinsurance, you would pay until you reach the maximum out of pocket for the plan, and then the insurance company will pay the rest of the medical expenses for that year. So that's a great thing to know, that no matter how much your expenses are, if you have some things that happen that are very expensive, you need an organ transplant or something like that, it's good to know that you will reach a point where you don't have to pay anymore and the insurance company takes over. So that's a good thing. But some of you may already understand this is how insurance works. I get that. But we're just covering that for people that may not be familiar. And we'll come back to this in just a bit. So what I want to show you next are a couple of statistics. That's easy for me to say. 60 to 70% of all doctor and hospital visits are the result of accidents. So if you're out playing soccer with the kids and you twist your knee, or you're painting the house and you fall off the ladder, those expenses that you're going to incur, and what all people incur in this country, 60 to 70 expenses of visits to hospitals are from these accidents. Now, almost the exact same amount, 60 to 70% of all healthcare expenses are the result of critical illness, cancer, heart attack, and stroke. So why am I mentioning these two things in particular? Well, I'm glad you asked. Let's go back to our little diagram here with the what the insurance policy pays and what you pay. Let's say that you were one of those who was playing soccer with the kids and you twisted your knee and you found out that you go to the emergency room, you've got some x-rays and things like that, you're going to need some surgery for your knee. That's going to be coming out of your pocket with your deductible and your coinsurance. Now, there is something that you may not have been aware of. There are policies, some people call them gap policies, but they are for specific purposes, and one of them, you can get accident coverage that would cover accident-related healthcare costs. So this would be in the case of if you had one of these accident policies, it would cover that accident. And this is a separate policy from your major medical plan, so it's not going to have a deductible or anything like that. But if you have that accident, you just submit those bills and they are paid. Now, these plans are not coordinated with your major medical plan. Now, what that means is if the bills that come through as a result of your accident are greater than your maximum out-of-pocket for your major medical plan, you may even have some money that the insurance company gives you that's left over. Now, I don't think anybody would suggest that you're going to go out and twist your knee and require surgery just to make some pocket change, but that is a possible scenario in that your entire out-of-pocket expenses from your major medical may be covered by an accident plan. Now, we also talked about the critical illness part. So there are plans that will cover critical illness. So depending on if you have cancer that runs in your family, or heart attacks or stroke, you may decide, it might not be a bad idea to get some critical illness insurance. And like we said, these are separate policies from your major medical plan. And the other thing that's important to know about these is that they are incredibly affordable. So this is something that I think people need to know about that may help them through a lot of the bumps down the road through the deductibles and out-of-pocket coinsurance may incur. The important thing about that is a little thing called medical bankruptcy, which I would just want to mention really quickly. Now, the American Journal of Medicine did a survey. They looked into bankruptcies and they found that 62% of bankruptcies are due to medical expense, which is not too surprising. 78% of those filing bankruptcy had some medical insurance. Now, this was survey was done, research was done in 2007, before the Affordable Care Act, and these policies came through that have their maximum out of pocket. Now, still, with the amount of premium you're paying, with the deductible and the coinsurance, even if you're with your high deductible, if you're paying $5,000 or $6,000 out of pocket, going back to our example of our 35-year-old making $20,000 a year, that $5,000 could easily tip that person into bankruptcy. Wouldn't it be nice if they had a cushion with that, number one, the major medical plan that they bought through the marketplace, and number two, some type of a gap insurance that's very affordable that could cause them to kind of put a cushion over those bumps. So we get on to exemptions. Remember, we talked about the three things that you needed to know. You needed to get covered, you needed to get exemption, or you needed to pay a fine. Well, we've talked about the coverage and the fine. Let's talk a little bit about exemptions. So you can be exempt from purchasing an Affordable Care Act plan by having an ACA approved plan already in place. So if you have group insurance from work, for example, you would be covered. If your spouse has it and you're on their plan, you are covered. You don't have to buy anything, but as long as it has the minimum essential coverage, you're covered. If you are uninsured for less than 3 months in a year, now that's important to note because, as we discussed, even if you bought insurance today on the marketplace, you are not going to be covered for that first period of time, depending on when you're watching this presentation. So you want to make sure you get covered as soon as possible, so you don't have more than 3 months in a year. Now, this is an exemption, I'd like to add, not from purchasing a plan, but an exemption from the fine. If your income is too low to file taxes, you are exempt from purchasing a plan. If you are a member of a federally recognized tribe, you're exempt from purchasing a plan or paying a fine. I should add that also for the low income. If you're incarcerated, if you are an illegal alien, if you have a hardship exemption such as homelessness or bankruptcy, and there are a lot of hardship type of exemptions that people can be qualified for, you are exempt from purchasing a plan or paying a fine. Now we want to cover some pitfalls that we have seen that have given some people problems in this last year. The Affordable Care Act was new. We had a lot of people that were new to health insurance coverage. They'd never had it before, and some things that they were not aware of, and we just wanted to cover some of those right here. Even reduced premiums have to be paid to keep your coverage. Now went back to our example about the 35-year-old with $20,000. That's not a lot of premium that would have to be paid to get that coverage. Now, some people got the idea, well, since most of my plan is being subsidized, I'll just not pay my premium and let the subsidy take over, and I'll just get reduced coverage. That's not the way it works. If you do have a subsidy and you are paying something out of pocket, you need to be paying that premium to keep the coverage. And the reason we mention that is that some folks are just not aware. You need to check the network of your policy and use those doctors. Don't make assumptions. You can also have an agent check for you to find out which policies and which networks are available, and that's a great idea. But when you are issued a policy, you'll be given a card, and you can call to make sure or go online with that company to see who is in your network. And you don't want to make assumptions because let's say you're going with you have a policy from Blue Cross or Blue Shield. Those companies have many different networks, And if you know somebody that got a Blue Cross plan and you got one that's different, you may be on a different network. You want to make sure you know beforehand who your doctors are that are on the network and who you can use. Changes in income will change the amount of your subsidy, and that's important to know. So let's say that you were that 35-year-old making $20,000 a year, and you got a raise, and you're now making $30,000 a year, and that's fantastic. But that's going to make a difference in the amount of subsidy. You would need to check in with your insurance company, let them know, so that they can reduce the amount of subsidy in your plan. If you don't, you're going to have to make up the difference when it comes to paying your taxes, and that could be a very nasty surprise. Now, it also works in the opposite direction. If you have a reduction in income, you may be eligible for more subsidy, so check with your insurance company throughout the year if that changes. Now, I'm showing this picture of the Supreme Court here because I'm sure that many have heard that the Affordable Care Act is going to go before the Supreme Court. Well, what is that all about? Well, what this basically means, if we go and look at the way the wording of the law is, the law says that all subsidies will be paid to people that purchase their premiums through their state-run marketplace. Now, only about a third of the states actually put together a marketplace. All of the other states that did not put together a marketplace or an exchange have the federal exchange take over. And all of the people, according to the way the law was originally written, who are getting their insurance through a federal exchange are not eligible for subsidies. Now, we don't know what the Supreme Court is going to say. They won't make their ruling until this summer, probably June or July. What we have to do is make a decision on our health insurance now during the open enrollment period. It's anybody's guess, and nobody can predict the future, what's going to happen, number one, with the Supreme Court ruling, and number two, what Congress will do about it. Worst case scenario, you can just you'll be paying more if the subsidy is dropped and you happen to be getting a subsidy. If it's too expensive, you could drop your insurance at that time. But you won't be able to get insurance if you wait to hear what the Supreme Court says. You'll have to make your choice now during the open enrollment period. So what do you do next? What's on the table? So going back to our three things that you need to know, you could get covered, get an exemption, or pay a fine. Those are your choices. You should also consider gap coverage that we mentioned, accident plans, critical illness plans, and those I want to make sure you understand are not available on the exchanges. Those are going to be available through insurance companies or insurance agents. And you might want to consider a gap plan even if you decide you're not going to buy insurance. You're just going to pay the fine. You decided the price is too much even with a subsidy, or I'm not eligible for a subsidy. Please, I would want you to consider that you should get an accident plan or a critical illness or something so that you have some type of coverage. And we're going to give you an opportunity on where you can go for that. What I would also say you should do is to get help from a licensed agent, but not all agents. And what do I mean by that? You probably have a lot of people that you know that are property and casualty, your car insurance, maybe even some people that are selling group policies. They may not be licensed or eligible to sell you a policy that's on the marketplace. Only a select group of agents are. They have to go through training and receive a certificate from the federal government in order to be able to do that. So what you need to do is to get help from a licensed agent. And the reason I mention this is that yes, you could go get the insurance yourself, but if you had the chance to have somebody who had gone through training to get their license, they had been background checked, They have got their certification from their Department of Insurance in their state. They've also been federally approved by the federal government. Why wouldn't you want to have that person help you if you have any questions? And the beautiful thing about it is your policy is not going to cost any more if you have an insurance agent help you. So why not have somebody that knows what they're doing help you with that? They can also help you with getting some gap insurance if you're interested. And the other thing you need to do is to tell others. And hopefully you've seen, based on some of the charts that we've shown, there's a lot of people out there that do not know what they don't know. They just are completely in the dark about what to do next. Tell other people about this presentation or what you've already learned. Uh, Please make it a priority because the clock is ticking. There's a limited amount of time that they can get this coverage. Now, if you are interested in getting somebody to help you, we have partnered with Please Insure Us. So I have up here the phone number. It's a toll-free number, and the website for Please Insure Us. Now, that website is pleaseinsure.us. If that makes it easier for you to understand, that's for everybody in the U.S. That's why it's .us and not .com. But pleaseinsure.us is the website, and the toll-free number is listed there, 844-204-5118. During this open enrollment period, the folks at Please Insure Us, excuse me, my voice is going here, but the folks at Please Insure Us are going to be open for 7 days a week in order to make sure that they can help as many people as possible. As you can imagine, a lot of people are needing help, have questions, and need help getting their plans in place. So write this number down, write this website down, give them a call, have your friends or family members that need insurance, give them a call. And please see what you can do about getting your questions answered. Now, if you would like, and you have some feedback on this presentation, I'd like to hear it. That's Marty at pleaseinsure.me. Make sure you make a note of that. That's a different website or different domain than pleaseinsure.us. I would love to help you if you have insurance needs in South Carolina. That's where I am licensed. But if you're not in South Carolina, by all means, call that toll-free number or go to that website. There's no reason not to get the information if you have further questions, and I would really love to hear if you have any feedback on this presentation or any other way that we can help. But please call the number. A licensed agent will be able to help you if you need some help with this. I hope that was helpful to everybody who was listening. I hope that it answered some questions. And as I mentioned, this is going to be available for a replay, and most likely you're watching it as a replay. If it is, just take note of the website domain address and just share that with others so that they can see this presentation also. We would really appreciate getting the word out to as many people as possible so that we don't have folks that have to needlessly pay a fine when they might be able to get insurance coverage for even less than their fine. So having said that, that's all I have for today. Hope this information is useful. Have a great day, and let us know if we can help further.